بسم الله الرحمن الرحيم وأما بنعمة ربك فحدث. In the name of Lord, as for the favor of your Lord, report his gifts to you. This is Asmaa Shaboun, and I'm recording to you to speak about my USMLE clinical skills exam. And it's actually all the favor of God and his help that he guide me throughout the way to succeed on this exam. I will be recording in English because while preparing, actually, so many people around the world has, they describe their trials through the studying and everything. And that's helped me a lot on my own preparation. So to me, I need to say thank you to them. And also, I knew that if you record in English, not only those who speak in Arabic will get benefit, but also all over the world. The second thing that I need to tell you why also I'm recording English, because I need you to know how I speak on my exam with the patients and how did I pronounce the words with them and what happened actually. They give me a high performance on English. So that's why I'm speaking English, to help everyone and to tell you, just give you a hint about my English. First of all, I have taken my exam on 27th of May 2016, and all thanks to Allah alone, I have passed with high performance on all the partitions. I have taken my exam on Philadelphia Center, and it's a big story because everyone's saying stay away from Philadelphia. You are going there, you are going to fail actually, and this is completely wrong. And I know a friend who just saw that I'm going to Philly, so he told me, you are going to fail. I have entered the exam 3 times there and I failed already. However, I want to assure all of you, please go to the Philly. It's a very good center. It's an excellent center. And beside all that, we have been actually 5. We all go to the Philly center. We all pass, and at least 2 of us had get high performance in all the petitions. Okay, so just to go to Philadelphia, you will like it. So what about the centers of the exam? We have 5 centers on the United States that you can take the clinical skills part, which is Atlanta, Chicago, Houston, Los Angeles, and Philadelphia. 2 points we need to know. First, you have to read the first aid starting from I don't know how many pages in the front of the book. It will tell you about everything about the centers on the United States, and it will tell you about the hotels and the restaurants around and everything, and how can you go actually, which airport you will land on, and how you go from the airport to the center and so on. This would be very nice to read the first aid CS part, okay? Second part, everyone is asking which is the best. I think everyone is going to Houston because they are saying that Houston, the patient there are accustomed to the international medical graduates, so they will deal easily with them, they will understand them, and so and so. I think you can go to any center. I myself gone to Philadelphia and I have passed there. So just go, prepare well, do your job, and go. You are a doctor, study, do your job as much as you can, and go, and you will get it, okay? Only one point we need to talk about, that Philadelphia, it's not just 1 center, it's 2 centers, okay? So always keep in mind when you're going and you get your scheduling permit that you revise which center do you have. Because I think there's a center 3642 and there's center 3700. That both centers are so close, okay? But the problem that if you didn't visit your center in I think the night before the exam, and you go in the morning only to go to the center, and you don't know where is it, you might get lost, and you think you will be late. So always keep in mind that Philadelphia has 2 centers. Keep in mind that you have to check the number of the center you're going to, so that when you go in the morning, you know that there's 2 centers and you will not get lost, okay? Because you need to go on time, not to be hesitated or interrupted in the morning or get worried, because you need to be calm down during the exam. Okay, I hope I have answered this question, which is the best. Now, talking about the exam format. It's 1 day exam, it's 8 hours, and you will have encountering 12 patients. And in the past, they have only 1 what's called break in between, but now it's more better. You have Every 3 cases, you will get 10 minutes break, and then you will have only 1 30-minute break in between. This will give you some sort of rest, actually, and it will give you some sort of taking a breath and be relaxed between each cases. So each patient encounter will take almost 15 minutes, and you'll have one bell to ring when you have only 5 minutes left on the encounter. After finishing the encounter, you go out and you have to write the patient note, which is only now computerized form. You will not write by your hand or the pen at all, okay? And you will have one bell also telling you there is 2 minutes left to write the patient note. The test part, the parts of the exam is only 3 parts. One of them is to data, gather and get interpretation of the symptoms of the patient and to analyze it. And then number 2 is the communication skills, which is very important part. And take care, all of the international medical graduates fail on the communication part and the proficiency of spoken English. Last thing is the spoken English proficiency, because currently they don't need you to have a TOEFL exam or have an IELTS exam. They need you just to speak to the patient well, understand them, and make the patient understand you, and that's all, okay? So we have to cover all 3 parts. Few tips about the exam. Many people have some few questions. Shall I take morning or evening sessions? Actually, it doesn't matter, but I myself gone to the morning session. It's a long day, and actually in Philadelphia Center we didn't feel it's long, because every 3 cases we have a break, and the people there are very kind people, so we didn't feel the stress of the day. But I don't know about the patients, because really they are the standard patient. They are doing their best to be patients. I mean, you might go to the room, you find someone who's really sweating and she's tachypnic, she can't breathe. I can swear this patient has been running throughout the room or jumping 2 minutes before I enter to the room. So I need you to know that patients may get tired. So maybe the evening session, maybe the patient are tired or exhausted. Maybe, but however, it doesn't matter, because the patient is a professional and he knows what he's doing. So, second question, I have already applied which center. Take whatever center you want, prepare well. These are patients and you're a doctor, you can go. The third tip I need to cover is about dressing. We need to focus on 2 things. If you are a male, just dress formal, have your shirt, have your pants, and make everything ironed. Wear black or gray or blue, dark blue. Just be formal, okay? You don't have to be dressed with a complete suit, okay? But just be formal as much as you can. Okay, for female, and especially Muslim female who are wearing hijab, I myself was wearing hijab, and it was long one too. And I was wearing bands and a top reaching below my knee. So, I mean, you can dress whatever you want. They will not judge you by that. I go there. I was the only IMG on the center that day. All of them are American. And really, it was some sort of distressing for me, because you are running to patients who are dealing with American doctors, and then you are going between them to say, I'm here, people. Please let me pass the exam. So you think your hijab can be interference with their interpretation to your dealing with them and your being as a doctor? No, it will not. They are fair enough to give you what you deserve, okay? I was wearing hijab, I was wearing long clothes, and it doesn't matter. And they gave me high performance and everything. So people, wear whatever you want is relaxing for you, and go for the exam. So what are you going to take with you when you go into the center? You have to take first, and the most important thing, you have to take faith. Be close to God. Have faith that you are a good doctor and you are doing your best, and these are patients and you're trying to help them. Okay? Keep faith in God that you're doing your job. You're going to do your job. Please keep faith in Allah. He will guide you. Second thing, to take few papers. You're going to take your passport. You're going to take your scheduling permit. And I will advise you to take some food with you. Some food like what? I took chocolate. I took some candy. I took some juice to the center. Why? Because all the offered food there are fast food, Most of them contains food you will not eat probably if you are a Muslim, okay? So there's also coffee on the center. There is also water, cold water, and plain water, not hot. And also you have there some fruits. So there's some biscuits. So you will be okay. But take few things with you that maybe if you don't eat, you have something to pack up yourself. On the center, I told you they will give you break. Keep you in your mind. Break is for bathroom. P for P. Break for bathroom. Okay? Why? Because usually there's only 2 bathrooms on the center and you all 24. Actually, in my center, we are 24 doctors doing the exam, not only 12, okay? So it's 2 sets of patients and we all around. So 24 doctors for only 2 bathrooms. And this is a real great problem. So always when you have a break, keep in your mind, I need to go to the bathroom. Because next breaks, you may not go. So just be prepared. Keep your mind on that, okay? So that you'll be relaxed at your encounters and you're fine. So going fastly to the cost, every year it's changing, okay? However, 2016, the exam is $1,200. You will travel almost $1,000 to $1,300. I was traveling on Qatar Airways. And then to have a place to live with, it's counting from $500 to $700 a month. Living, which is food and traveling, and so inside the US itself, it will cost you from $500 to $700, depends on your food and whatever you eat. And the house, it's gone from $400 to $800, and it depends. Actually, I live in somewhere in Philly, it costs me $1,000. However, it was very nice with security and everything, so I think it deserves. Going there to now I'm outside United States and I will go to take my exam. So what exactly the time I need to spend in the United States before going to the exam? How long shall I stay for taking the exam with a good English and good communication skill? Only 2 weeks, people, is enough. So you just prepare your travel before the exam 2 weeks and it will be good. During these 2 weeks, you'll try to get some study partner and you're going to study together. About your English, listen a lot to the BBC World News or the CNN. Try to catch up the accent and the pronunciation. The accent is not a major issue, but speaking well, make the patient comfortable with you, make the patient feel that he can communicate with you. That's it. What about the failure causes? I will cover this while throughout the session now. However, I just need to tell you it's an attitude. What do you mean by that? In the morning when I was going to the exam, I find everyone nervous, everyone tired, everyone exhausted, and they are all praying to pass the exam, and they are thinking this standard patient is an actor, and I need to deal with him as an actor, and I have also to act like a doctor so that he can give me the grade to pass. And he feels that his all future on that actor hand. If your attitude like that, you will be always saying the word that I really don't respect, which is, these patients are acting, so also you have to act, or please fake the encounter, make yourself a good person, and so. These words will make you fail, okay? I saw American doctors going out from the exam very nervous after finishing the day. They feel they will fail because you're trying to act. Please don't act. You are a doctor. These are patients. Don't think in your mind these are acting. No, they are patients and you are a doctor. They will not say if you are a doctor or not. You have already studied the medicine 7 years ago. You are a doctor in your country. You are a doctor everywhere. You are just going to take an exam and you are not waiting for this patient to evaluate you. You are doing your job and he will give you tick only in what you have done good as a doctor for him, as a patient, okay? So I don't care what they're going to say at every encounter before I go. You know, they give you a few seconds between the announcement where they are saying, standardized patient, please prepare, and then the announcement, you can start your encounter. In these few moments, I just ask God, please God, help me to help the patient inside this room and to do my job with him. I pray like that. I enter with a good face, smiling face, because I need to help that patient. He feels so, because I really want to help him, and he catch it. You understand? So don't please act. get the attitude of a doctor who need to help his patient, because you will live your life doing that. Going later to something called the draping. We have been always taught that there's a draping story that when you go to the room and you say, hello, I'm Dr. Asma, I'm here to help you today, and so and so. I will tell you how to introduce yourself. But they're saying, just take the drape from the chair and put in the patient leg. I want to tell you something will shock you all people. This is an old story. What I mean by that, now all the patients are already draped. They are already draped. The only patient you might not find draped, the patient that who is already walking in the room. I mean, you can enter to the room to someone who has mania or someone who has some substance abuse and they are manic. So you find him walking in the room, looking around, trying to talk to himself. Maybe you will find some patient like that. This patient, of course, he will not be draped. So when he sits down, before you examine him, you will drape him. Otherwise, all the encounters, all the patients are draped. Okay? So just remove this part from your head. Now, going to something new, how long do I need to prepare? What's the time I need it? It depends, actually, in your circumstances. If you are a free, complete person, it will take from 1 to 2 months. You are staying at home, you're doing your job, you're studying from 6 to 7 hours a day throughout the week. And if you are working, someone who has a work as a resident, or you are still studying and so, and you get some available time to study at home, almost 3 hours daily for 5 days a week. So you will need from 2 to 3 months, and I will suggest 3 months. And you will need 10 days at the end of the 3 months to 2 weeks to be completely dedicated to the CS study. So for me, I have been studying for 3 months because my CS exam was very, very late from my step 1 and step 2 exams. 4 years almost between both, because I didn't have the fund to take my CS. So I prepared CS in 3 months, and I was working with it as a resident also. So I dedicate myself for only the 2 weeks which I gone to the United States before the exam, and these 2 weeks was completely dedication to the study, and it was the maximum of my study during these 2 weeks. So plan your study well from 2 to 3 months, and keep 2 weeks as a vacation from any work you're doing, okay, before you go to the exam. There's a question, some people asking, shall I take my CS exam before my step 1 and step 2 or after that? Actually, there's no rule, either before doing your other any step, or actually myself, I prefer after step 1 and step 2 CK. I think so, it's better to have it. However, it doesn't matter. It's completely different, okay? So, there's a few questions about what are the sources that you get to study from. There's so many sources for the CS exam, but you have to focus on few things. The first aid, of course, for the CS step. Number 2, Dr. Muhammad Said notes, which containing Dr. Samir and Akar notes, also from Syria. It's really nice notes, and I'll tell you how to use it. Third thing is Niraj notes. These notes are very good for the transitions and the communication skills part to teach you how to deal. And then some few entire videos which are really good videos, and it helps me a lot. Dr. Hussam al-Nawasra has made many videos about CS exam. One of the most beautiful one is the 3-hour preparation for the CS by Dr. Hussam al-Nawasra. It was really nice. Other one is Dr. Omar Zakaria video. It's also, I think, 2 hours for preparation. It's really nice. Then we're going to the CSE videos. These videos for the clinical exam encounter and the practicing the encounter itself. It's really nice. It put you in the position as if you are already on the encounter, and what are you going to do? How are you going to take the history? How are you going to manage your time? How are you going to counsel? It's important to watch all of the CC videos. And then we go to something called the study partner. If you don't have a study partner, don't go to the CS exam. You will fail. And as they say, it's a recipe to fail. So recipe to fail doesn't have study partner. So you will need, it's very, very, very critical. I cannot say how important is it. And we will discuss later about that. At class, I have my own notes, okay, for the systems, how to ask about the systems and how to organize your mind about each case you will go to so that you will not be lost, okay? You feel free to use whatever system you do, but feel comfortable with it. I have my own system, I was doing my own notes, and I will share with you my notes here. If you like it, you can apply it to the exam. It will help you a lot and it will make you feel relaxed with the encounter and feel some sort of comfortable, and even the patient will feel that you are organized and he will offer you information if you didn't ask about it. It was amazing. I'll tell you later about my own experience. How can you manage the encounter, How can you manage it? It's 15 minutes. And they are saying, it's not me who's saying that, but they are trying to tell us that you try to make history from 7 to 8 minutes, and then you try to manage your physical exam from 3 to 5 minutes, and then get 2 to 3 minutes for counseling. I will tell you something. It's not strict. It depends on your practice. So when you practice, you will know how you will manage your time, okay? You will know this case needs a lot on history, this case needs a lot on physical exam, especially neuro cases, and you will, with practice, it will come naturally that you finish the encounter in 15 minutes and even before that. Okay, I need to teach you something. Always try to finish the encounter before the announcement. You will teach yourself that you need to finish the encounter in 13 to 14 minutes. Actually, my own self, I finished all my encounters in 13 to 14 minutes. It's only 2 encounters, and most of them are in Euro, when I was shaking the hands of the patient and announcing when saying, this encounter has ended. Please leave the room. This only 2 encounters would this happen to me. Otherwise, I was finishing all the encounters before the announcing come, and I was going out of the room earlier than Americans also. And I have passed with high performance. So what I'm talking about, try to manage your time, and you finish early is very good thing for you to write your patient note, a good patient note. So practice always to finish early, because some people teach themselves they will finish at 15 minutes. On the real life and on the real encounter, you may take time because the patient will talk to you. The patient will ask you questions. The patient will try to distract you from the encounter. And if you don't learn how to finish earlier, you will not finish the encounter. And I see so many doctors saying, we couldn't even finish the counsel because the time has over already. And we left the room interrupted. Imagine you are talking to your patient and suddenly you are interrupted and saying, sorry, I will leave now. Oh, this is really bad. So teach yourself to finish early. About patient note, you will try to finish in 9 minutes, not 10 minutes. Why? Because you will have some time to get out from the room, to shake hands, to get out from the room, to sit on your chair and to hold the mouse and to start saying, oh, what I'm going to write. So you will need at least 1 minute to do all this. So keep in mind that you need 9 minutes to write, not 10 minutes, because you will take 1 minute to get into the chair and start writing. And this is really good because always the time is not sufficient for the patient note. If you teach yourself to finish in 9 minutes, it will be nice. There is something also we need to agree with, that anytime you left on the encounter, I finished the encounter in 14 minutes, so I have 1 minute over. This 1 minute will be added to my patient note and it will help me to write a good patient note. When shall I start practicing my patient note? I think 1 week to 10 days just only before the exam, which I told you before, these 10 to 2 weeks that you have to be dedicated. This is the time to have practicing your patient note, and that's enough for it. What about the doorway information? On the doorway outside, you will find the name of the patient, his age, his vitals, and the complaint he's coming with. I will give you very good advice. It's very important to put your sheet, to put your mind on the system that you're going to ask the patient about. Don't enter the room before you have a mind map before going inside. If you go inside, you don't have a mind map about what's going to happen inside, you are losing points. You are losing your communication skills, you are losing your confidence, and you will lose much, okay? So, pay attention, take from 40 seconds to 1 minute. Always while I was standing and all around me are American doctors on my encounters, I always got into the room late. And I think only 2 or 3 was after me. but I always take from 40 seconds to full minute before I go to the room to put my mind and to say what I'm going to do inside when I go in. So keep this in your mind. This is very important, and it will help you to look to the patient as a professional doctor. Going to a very important part that everyone is asking about, how I will prepare. I'll give you just broad plan. There is something called the start point. The start point is very important, and you will give it 8 days, 8 to 10, it depends on you. First, you have to practice the encounter starting, the transitions and the closure, which mean how will you go to the room, and you are transitions between the history, the family history, the sexual history, how I can have some phrase to go from this discussion to the new discussion. This is the transitions, okay? And you'll practice the closure, which means how can I finish the encounter in a good way? So you will have 3 days for that. And please, only 3 days. You'll have 1 day for the starting of the encounter to teach yourself how you will start the encounter. You have 1 day to study transitions and 1 day to study closure. I respect other people saying take a whole week to practice starting the encounter, transition, and closure. It doesn't matter, and this is a very long time. Okay, it depends on you, but I think 3 days is enough. And then you're going to study the frame. The frame is very important. What is the frame? This is the paper that you're going to draw. It's called cheat list. You can say the frame, the checklist, sheet list, whatever you want to call it. But it's the paper you're going to draw before you go to the encounter. This is the paper you're going to fill when you are standing in front of the doorway information. Then you're going to practice the review of systems, which is really, we can say, it doesn't matter what system you are going to discuss with the patient inside, but you have to review these systems. So it's something stable in all the encounters. So you have to save it well, and you have to apply to all the encounters. And we have some mnemonic to cover that, which is my own mnemonic. I make this mnemonic, and I hope you will like it. It's called fever, burn, sawadi. And I will tell you what's meant by fever, burn, sawadi. And this mnemonic, I need you to study it for only 1 day. Doesn't need to be more than only 1 day. Then you're going to practice the past history part, and this also a stable, fixed part of your encounter. And I make it as Pam H. Foss, and you're going to speak what is Pam H. Foss mnemonic. This one is really important, so it will take from you 2 days to study it. And then after you finish all these, you will take 2 days to practice all these parts in your own room alone. So you will close your door of the room and you stand outside, and you will put a paper, put it with the tape, okay, fix it to the wall of the fix it to the door of your room, and start if you has a real encounter. Knock the door. Hello, this is doctor, and try to practice your encounter, your transitions, your closure. And I will give you an advice. While practicing during these 2 days, what I said above, practice in front of a mirror, as if the mirror is your patient already. So you will see yourself in the mirror, and you will see how you smile, how you react. You'll get an idea about your shape in front of the patient, okay? Now, going to the study itself, the start point for only 1 day. To take 1 day only, please. So you have to save these lines on this slide. You'll knock the door like that, and you'll open the door. Don't enter, please. Just tell the patient his name. So in the doorway information you find James Bond, for example. So, or Clark James. So you'll take the last name which is James or Bond, and say, Mr. James, and don't enter. He will say yes. Then you can enter, and you say the following. Hello, Mr. James. I'm Dr. Asmaa, the attending physician here today. I will take care of you. Nice to meet you. And you can shake the hands at saying nice to meet you. And you say, I'll be asking you some questions and perform a physical examination. Do you mind if I write down some notes while we talk? He will say no. Then you can say, thank you. Okay, Mr. James, how can I help you today? At this point, he will tell you his complaint. I have pain, doctor, in my chest since this morning. Then you say, I'm sorry about that. I'll do my best to help. Then you have 2 options. Either to ask an open-ended question, which is like, can you tell me more about it? Or you can start analyzing the complaint in detail. Okay, tell me exactly when you start. How frequent do you have it? For how long does it last? As if you are analyzing and you didn't give him another open-ended. It depends on you and it depends on the case. I will not give you any specific answer which is the best. It depends on you, okay? So I will give you a little sense of what will happen. So now I am standing outside and the announcement is there and it's giving you SBs, please prepare. And then he will say, dear applicants, you can start your first patient encounter. At the time you will open the doorway, you write your frame, and then you will knock the door. Mr. James? Yes. Hello, Mr. James. I'm Dr. Asmaa, the attending physician here today. I'll take care of you. Nice to meet you. I'll be asking you some questions and perform physical examination. Do you mind if I write down some notes while we talk? No. Thank you. Okay, Mr. James, how can I help you today? Oh, I'm so sorry about that. I'll do my best to help. Mr. James, can you tell me more about it? This is what it would look like when you are studying and practicing. Then we go to the transitions. And also, please, one day. As I told you, transitions are the statements that are in between the moving from a point to another point. You'll try to be fast on these parts. Because when I was studying from Niraj notes, it's really nice. But while you are practicing, you have to minimize the words you are saying because you don't have time to finish the encounter if you are, before everything, you are going to say it in detail and saying it very slow. No, say it fast, say it professional, and make it understandable. So you take the history, you analyze the complaint, and then you are moving to the review of other systems, which is outside the system that you analyze already from the complaint. So you're going to say, okay, Mr. James, now I want to ask you a few questions to review your other systems. Is it okay? He will say, yes, you can. Go on. And then before the past history, you're going to say, now I'll ask you some questions about your health in the past. Is it okay? And then you can go. Before the family history, I'll ask you a few questions about your family health. Okay? And then before the social and sexual history, you're going to say, now I'll ask you a few questions about your day-to-day activities and your sexual health. I assure you that everything will be kept confidential. Is it okay? And you will say, okay. You have to make sure that you need to formulate this statement as I say in front of you. Because if you go before the social and you say, now I need to ask you some questions about your social life, and then you go before the sexual, now I need to ask you a few questions about your sexual life, and I assure you everything will be kept confidential, you are taking long time. And you are wasting your time. Believe me, you are wasting your time. So just make both as one point, okay? As one transition. It will be nice and the patient will appreciate it. So this is what I do in all my encounters, that I make both social and sexual the same, okay? And I always, after saying this statement, I start with the sexual part. Why? Because you said it will be kept confidential. So try always to make a patient mind connected between the word of confidential and sexual, and then you can go to the social, okay? So keep the social at the end, which is alcohol, the smoking, and so keep it at the end, but keep sexual first. So when you are saying this transition, discuss the sexual history first, and then you can go to the social one. And you have to make sure you say the word confidential. This is really important, okay? Then before you go, you finish all your history, and you're going to the physical exam. Before going to the physical exam, it's very important to thank the patient for sharing his problem with you. So you will say, thank you, Mr. James, for sharing your problem with me. And just to summarize what you have said, you told me you have so and so and so. You have to summarize the history somewhere during the encounter. And the best time to do that, from my point of view, is before you go to the physical exam. Why? Because you are still holding the pen in your hand and you can write anything he told you extra. After you summarize it, you can say, okay, now I'd like to perform a quick physical exam. Is it okay? You say yes. You will say, thank you very much. Can you excuse me for a moment? I will wash my hands. And then you can go to wash your hands. While washing your hands, there are a few tips I need to share with you. First, you have to know that the tub that you'll wash your hands on is just in front of the patient. So while washing your hand, you will be literally, your back will be to the patient and your face will be away from the patient, and this is really bad because you're going to lose the eye contact. So you need to focus on, while you're washing your hand, you will be on your side. I mean, as if you are on the side of the tub. So your face will be as a lateral view, you are seeing the patient and you're washing your hands on the other side. Okay, so keep eye contact with the patient while you are washing your hand. While washing your hand, you need to use this time. So some people saying you can start any conversation. What do you do for a living? What do you think about the weather today? What do you think about what's going on in the United States? Whatever you wanted to do. For me, I was always asking a question that will save my time later, which is there anything else you would like to add or discuss? I always ask this question. Sometimes they will ask you the question of the trick on the encounter on this time. I have a patient told me, doctor, this pain makes me not going anymore to walk my morning walks, and I feel so bad about it. That time I will say, I understand, I will do my best to help you so that you can soon go back to walk your morning walk and enjoy it. I know the weather is very good these days and it deserves a walk in the morning. She smiles at the time. So you need to have a question while washing your hands. And this is my typical question that I use. Is there anything else you'd like to add or discuss? Okay? Now, for one day, you're going to the closure part. I will say it, the pass ticket part. This part is your passing ticket. Yeah, you will pass the exam with it. So what you're going to say? You're going to say, try also to use the patient name, okay? Because he's a patient, right? He's a human being. So try to use his name. You will make him feel that you really care, you know. He's not a patient that you don't know him and you don't care about his name. No, make him feel that he is a friend. So if you know the name and you can memorize it, it's really important. So you will say, thanks, Mr. James, for your cooperation. From the history and the physical exam, you almost probably have this problem. However, there are some other possibilities such as that and that. To rule out these possibilities and to know what exactly the problem, we will need to run some blood tests and some imaging studies. Once the results are available, we will meet again and discuss the final diagnosis and the further management to that. Then you're going to counsel about the alcohol, the smoking, and the sexual part. This part, I will advise you to take it from Neurage Notes. It's really nice. And I will say just a little hit about it. You will say, but Mr. James, as your concerned physician, I will advise you to try to quit smoking. It's really dangerous and it would affect your health in a bad way, and it's connected to many diseases. We have a very good program here that can help you in this. So if you are interested, I can give you a pamphlet about our program and we can discuss about it later. Are you interested, sir? Like that, okay? Also on the alcohol, you can say the same, and sexual part also. So take it from Neurage. It will take a moment to say it to the patient, but it's also from the pass part, as I said. After you finish the counseling, you go on to the last few lines, which is, okay, Mr. James, do you have any other questions or concerns for me? He may say yes and tell you something, and he may say no. Then you will say, okay, we will meet soon once the results of your lab are available. Feel free to contact me if you have any other concerns or other questions. It was a pleasure meeting you. Have a nice day. Don't forget, please, to shake the hands at this point. So shake hands when you're going in. Shake hands when you're going out. It's important, okay? Good. And smile. Keep your smile on your face. They was always saying, take your smile with you. I will say, take your personality with you. And if your personality is not lovely, this is bad. Teach yourself to smile and make people happy around you. Now, the frame I told you about. This is the checklist that you're going to draw before you go to the room. Some people are saying the checklist has to be, if you are drawing 3 columns, okay, parallel to each other. But really, I studied many forms of the frames, and this one is the best, and it helps me to write my notes in a good way before I go to the patient. And I formulate all my study with this checklist. Please feel free to use it. It's a really nice one. First, above the first line above, I just write the abbreviation of the doorway. So I write male or female, his last name James, his age 46, the abnormal vitals, which is temperature or blood pressure like that. And then on the side, I didn't write here, which is the complaint, just pain, abdominal pain, anything. And then I just draw 2 lines crossing each other. So I divide the paper into 4 quadrants. The first one to the left is OBD SFC. Okay, so like that here, OBD, onset, progression, duration, SFC, settings, frequency, constant or not, and LICURA, which is for the pain management. So this part, this quadrant is for the complaint. Okay, you are going to analyze the complaint that you go on to the patient in this quadrant. These questions here on the quadrant, you will find on the neurology notes on detail, how you ask about the onset, the progression, the duration, everything, and the LICURA for the pain. And then here on the right side, this is the part of the review of systems, which I told you before that I use the mnemonic, which is fever, burn, sawadi. So I will tell you later about what's meant by fever, burn, sawadi, but you will always try to draw it like that. And I write fever because fever is the word of fever. It's a mnemonic and it's a word for its own self. And then I write below it burn like that and sawadi like that, each letter above the other, because I'm going to write something here beside it, okay? Then you go to the left lower part, and this part here, this quadrant, is for the past history, which is PAM H FOS, okay? We'll talk about it later. And here I keep it for the counseling part and the important parts. So if the patient told me he's smoking or drinking or something, I just will write it here to remind myself that I need to discuss with him at the end the smoking or the the smoking or the alcohol or sexual, so that I will not forget anything to counsel him about. Okay? So this is the frame. Now we're going to analyzing the complaint, which is the left quadrant on the top we told about. This one is very important, so it will take 2 days. So any complaint, you are going to discuss the OBD, SFC, and the 3 A's. You'll get these abbreviation, what this mean, and how you ask it from the neurology notes, okay? Then there is a specific mnemonic for the pain, which is the LICURA, also from the neurology notes. And then there is a specific question for any fluid or discharge from the body. If the patient told you, I'm coughing and I have something when I cough, you're going to discuss. If it was a female with vaginal discharge and she has a discharge, you're going to discuss it as the EBCO. How are you going to ask it? You need to be fast because it doesn't need to take much time from you. So you'll analyze it like that. A is for the amount. How much is it? Is it teaspoon, tablespoon, or cupful? Then, is there any blood on it? What color is it? Does it have any special smell? These questions are just for fast. You will teach yourself. So you will study all these parts in 2 days. Save them well. Practice them well. Then you go on to the system review. System review, it will take 1 day, as I said. So the mnemonic you're going to save is fever, burn, sawadi. So fever is for fever, and it's all contributing to fever. So how you will ask it? Fever. Do you have any fever? Any chills? Any sweating? Do you think you are sweating more on the night? Do you have any travel history? Like that. So all these parts are covered by the fever word. Okay, so when I say fever, you are going to ask all these: fever, chills, sweating, and travel. This is very important. Okay, then the mnemonic burn. Each letter from the burn word has something specific for it. So first, B is for bowel, U is for urinary, R for the rash, N is for neuro. So first, B for bowel, you'll say, is there any changes in your bowel habits? Do you have any abdominal pain? And then, is there any changes in your urinary habits? And then, do you have any rash? Do you have any headache? Now you cover the burn mnemonic. Now you go into the sawadi mnemonic, and you start with the S. S for sleep and for stress. W is for the weight. A is for the appetite. D is for joint, and E is for exercise. And you're going to ask like that. So how's your sleep? Do you think you are under more stress recently? Did you notice any change in your weight? How is your appetite? What about your dieting habits? Do you exercise regularly? At this point exactly, I need you to focus. If he said, yes, I run every day, you have to acknowledge that. You say, oh, wow, this is very nice. I encourage you to keep on. Say that, please. This will give you a bonus grade. Now, going to the past history. This one will take 2 days for you to practice, and it will cover the PAM H FOS. P is for the past history about all the similar episodes, any medical problem, is a surgical problem. And then A is for allergy, M for medications, H for hospitalization, F for family, O for occupation, and obstetrics, if it's a female, okay? Which is you're going to ask about the periods and everything about it, menstruation and so on. S for sexual and then for social. That's why I told you I'll discuss sexual first, because you're saying the word, it will be kept confidential. So P for past similar episodes, medical problem and surgery. You're going to get these questions from the neurology notes. Allergy, you will say, do you have any allergies? And then you're going to say, are you taking any medication or have you taken any before? Have you ever been hospitalized? Who knows that? And for what? Family. Does anyone of your family has a similar problem? He will say yes, you will say no, you have to discuss. So how are your parents? If he said my dad passed away, you have to say, oh, I'm sorry for that. What was the cause? You have to know why he passed away. Maybe it's a cardiac problem related to your story. And then you go to occupation. What are you doing for a living? Something like that. If she's a female, you're going to ask about her menstruation. Are they irregular? Does she have any pain with them? Also, this part is covered on your notes. About sexual birth and social birth, I will advise you to take it from Muhammad's side notes. It's really nice there, and it's covered in a very good way. Now, the 8 days we speak about has almost done. What I mean by almost done, you have now covered the all encounter, the general encounter for all the systems. I mean, you know how to enter the room, you know how you will start the encounter, you know what you're going to say to contact with the patient on the first, and how you will be transiting from one system to another, and how you will close your encounter. Okay, what about your skills, your communication skills with the patient, how you will smile with him, how do you see yourself in the mirror when you're interacting with the patient. So now you need to know each complaint and each system, how you will deal with it. And this part is really important part, and it's most of your study will be on this part actually. That's why I said the first part has to take 8 days to 10 days, and then you're going to focus on the bulk of your study, which is the system. So I have a different strategy about that. You can take it or you can refuse it. You can do anything you like. However, it depends on you. Have your own system. My strategy that I was using, that each system I will study alone. I will study chest alone, cardiovascular and chest. I combine both together. So I have cardiovascular and chest alone. And then I have the abdominal system alone. Then the neuro alone. Rheumatological cases alone. And then what else? I mean, all the systems, gynecological cases alone. So I make each system alone, and I start to study it as a complete different format from the other one. What I do for each system, I start from Dr. Mohammed Said list. So Dr. Mohammed Said, for each system, he has a list of questions for all the complaints in a single system. And this is helpful. So you will only save, you have 7 systems, you will have 7 lists of questions, you have to save it well, and it will cover all the system. Then I go to my own frame to that system. So I study the questions, and then I have a frame, one frame to the whole system. So I have 7 frames or 8 frames that I will save in my mind. Okay? So I save the question, then I go to my frame, and then I study the frame with the questions of Dr. Mohammed said. I practice them. Okay? So you practice them as if you are saving the whole system as one category. Then I need to know, okay, I save the questions of the system. So what are the special cases on the system? I will get them from the long cases found on the first aid. So I open the first aid. You have 48 cases, long cases on the first aid. I will, locate them. Allocate all the cases on that system alone, because they are scattered on the first aid, the long cases, they are scattered everywhere. So you will try to catch up which the cases are related to the cardiovascular chest and put them aside. What are the cases related to the neuro and put them aside, okay? And then there is many cases on the front, which is really nice, organized depending on the system. So also I read them. And from the many cases, what's really interesting about it, that it will help you to make a differential diagnosis list for each system alone. And it will make you have a mind map. This will help you to interact with the patient, to tell him what you think about his case. And it helps you also on the patient note, so that you know what you're going to write. He's a chest pain. Okay. What are the causes of the chest pain? What I'm going to discuss with the patient, what I'm going to write on my patient note differential. This is all from the many cases. At last, after you finish all these, which is studying the list of the question to the system, studying the frame of the system, going to the first aid long cases of the system, going to the mini cases of the system, making my differential for the system. Now it's time to study alone that system, in my own room, with my own door, on that system. I make my mobile, have 15-minute alarming, and then I start by knocking the door. I write some few lines from the first aid long cases to practice it alone, and I imagine there is a patient in front of me, and I try to begin the whole encounter without the physical examination part. I just trying to figure out the history part, how can I manage it, and then I'll go to practice later with someone on Skype. Okay, this is the study partner part, which is very important. Now, what you're seeing currently is one of my own frame to the systems. I will not go thoroughly with it. You will need to read it and you understand what's on it. But just to give you an idea, now you study the Dr. Mohammed Said notes about cardiovascular system and chest. You will find writing one line above, which is OPD SFC, that we agreed it will be the analysis of each complaint alone, and then the pain questions is very important in the cardiovascular system, and then what increasing, what decreasing, and any similar episodes. All these are on Said notes. Then what's really good inside the Dr. Said notes is that for cardio system, he is giving few questions, which is how to ask about racing of the heart, how to ask about getting dizzy, do you have any swelling in the leg, and then you'll find the panic, and then the chest, and then sickle disease. The panic question, how you will ask about if you think it's a panic disease, how you will ask about it. If you think this is a chest case, so you will ask about, do you have any chest pain, do you have any shortness of breath, SOB, do you have any cough with sputum on it, and you will ask about wheezing. This is what I'm talking about. Here cardio, you will find how to ask this line on Dr. Mohammed Said note, and also the panic and the chest pain, shortness of breath, cough. Do you have a sputum with cough, wheezing? How to ask about these, okay? Because these are the things that you are going to ask about on that system. And then there's few things that's really important on that system, and it's specific to that system. You need to cover, and you shall not forget it, okay? And this is what I found in all the checklists I found online, always forgetting. Okay, because they have only one checklist for all the systems, so they are always forgetting the points that specific to each system, and really it's damaging you. So what is specific about cardiovascular and pulmonary is upper respiratory infection. You have to ask about it. You have to ask about it. Do you have any runny nose? Do you have any sore throat? Is there any discharge back on your mouth? Is there any swelling on your neck? And you have to ask about the fever. We said fever will be in all pneumonic. But on fever, you'll never forget to ask about if he has the PPD test. Okay? And just don't ask and be some arrogant and say, do you have ever done a PPD test? He will say, immediately he will ask you, what is the PPD test? Now you are losing points, because you shall never say any word to the patient that he cannot understand. So when you ask this question, you have to analyze it and break it down. You will say, have you ever get a PPD test, which is a skin test we do usually to check for if you have any tuberculosis disease? He will say, no, I never done that. Or, oh, yes, I done before. Okay, so break this word. Also, what's important on the cardiopulmonary system is heartburn. Never to forget, do you feel burn on this area? And you can really point your hand toward it, but don't touch your what's called white coat. Don't touch your white coat. If you touch it, you have to go and wash your hands again. You need your hands to be clean. So when you are asking the history, or while you are, if you ask this question while after you wash your hand, don't touch yourself, okay? So after we said this is the all the question to all the cases on the chest, and this is the checklist for the cardiopulmonary and pulmonary chest cases. Sorry for that. Okay, here you will find me writing the cases that really will face you on the CS exam, which is chest pain, shortness of breath, cough, sore throat, palpitation. Each case of these has its own trick, small trick. You need to ask about trauma to the chest, on the chest pain. You need to ask about panic attack. You have to ask about pain questions on detail. And if you think this case is really an emergency case, you need to talk to the patient that you will not let him go home today until you are sure that he's okay and safe to go home. This part is really important. It shows the patient that you are really caring. Shortness of breath, you will ask the DOP questions. DOP questions, which is dyspnea, orthopnea, sorry for that, dyspnea, orthopnea, and paroxysmal nocturnal dyspnea. These questions also you will find on a doctor's side note, and this question is specific for the shortness of breath. So you have to ask these questions beside all this upper list if the case is shortness of breath. If the case is cough, beside all the questions up, this cough need few things you need to ask about, which is ABCO that we should talk about, that you need to discuss at the discharge. And then you need to ask about if there is any change in the cough between day and the night. Okay, is he waking up at night with cough? You have to ask these specific questions to the cough beside all these common questions. And here there's a trick for communication skill. If you see the patient coughing a lot, you need to offer a cup of water. This is considered something nice. Okay. Also, if he is holding a tissue in his hand, you have to ask him, can I see the tissue? Because sometimes there is a blood on the tissue, and if you see the blood, you will get panic. Oh, there is blood. So you have to consider really tough disease or emergency case. If you have a sore throat case, you need to ask about the ear pain. Don't forget that. Maybe it's otitis media. You need also to ask about neck swelling. And if you find the patient cannot talk well and is doing the sound, you need to offer a cup of water, okay? Then the palpitation case. There is something specific about palpitation that you're going to ask about panic, which is here, the panic question, fear of death, and those questions. You need to ask about caffeine. Do you drink a lot of caffeine? Okay, and also don't forget the palpitation need differential of thyroid. So you will also try to ask about if he feel hot all the time, and so and so and so. And you will never forget on the examination that you're going to check his neck for the examination to see if there is any swelling. So now I am standing outside of the door, and I open the doorway information, and I find a case that belongs to the cardiovascular system or chest, which is either chest pain, shortness of breath, sore throat, cough, or palpitation. So what I'm going to draw on my frame is this paper. If you see it, you'll find 4 quadrants, as I said, and you'll find the OBD, SFC, increasing, decreasing, the cardio questions, chest questions, and then going to the review of system, fever, burn, and then Sawadi, as we said, and then here PAM, H, false. And this part is counseling. I was studying with my own, however, it's here for you if you need it. So these questions you'll find from Niraj, as you said. What about the cardio and the chest? What I'm going to ask here, go on back, I'm going to ask here these lines: racing, dizzy, swelling, chest pain, shortness of breath, cough with sputum and wheezing. So these 2 lines, I get it from Muhammad Sayyid, as I told you, and I put it here as mnemonic, small mnemonics for myself, okay? So if you have a chest pain, you will ask like that. Can you tell me when does it started? Progression, you will ask. Is it getting better or getting worse? For how long does it last every time you have this pain? What exactly were you doing in the S setting? You will go, what exactly have you been doing when this pain started? And how frequent did you get it since this morning? And is it always there or come and go? You feel it come and go, or this always you feel it? Okay, and what increasing the pain? Okay, what is relieving the pain? And then here cardio. Do you feel your heart is racing? Do you feel dizzy? Is there any swelling in your legs? So you see, I ask here all the questions I have on the previous paper. For the chest, okay, do you have any shortness of breath? Do you have any cough? Are you wheezing? So these two words cover so many questions for me, but I just write them here to remind myself. Fever, I will ask. Fever, chills, sweats, trouble, and what is specific here on the review of system for the cardiovascular and different from the common, what can we call checklist, is the PPD test, the heartburn, upper respiratory tract infection. So now I save it. And I have something here. You see the circle? This circle is important. Why important? Now, if this case is chest pain, I told you I have few questions special for chest pain. So in this circle, I will write what is exactly specific, which is these two lines. You see it? Trauma, panic, and pain. So, or shortness of breath, I write DOP to remind myself. So if I have a case of shortness of breath and they ask all these questions, and I finished here this part, before going to the checklist of the review of system, I will ask what is in this circle, and this circle I will fill before going to the room, entering the room, okay, of the patient. So this case is shortness of breath. So what is missing on this checklist? Oh yeah, I need to ask about dyspnea, orthopnea, and paroxysmal nocturnal dyspnea. Okay, another case, it's palpitation. Okay, I will ask all this checklist. Okay, but what is specific to palpitation? Oh, I need to ask about caffeine. I need to ask about racing of the heart. I need to ask about, feeling hot because it's thyroid, maybe thyroid. So after I've analyzed the complaint, I will go to the what's specific, and then I will go to the review of system. Okay, so this circle in all the systems in the future is specific parts that is going down here before each complaint. Okay. Now we finished the cardiovascular and pulmonary. Now I'm going to the GIT cases. It's the same story, the same questions about the analysis of the complaint, OBD, SFC, what's increasing or decreasing, and now going to the GIT case questions, which you will get from the doctor as side notes, as I told you, and you will teach yourself that you will cover it like that from up down, difficult swallowing, then nausea, vomit, heartburn, abdominal pain, diarrhea, constipation, and what about the stool? If the case is constipation or diarrhea, there's few questions you need to save also. How often do you have it? Is it painful when you pass stool or urine? And when you pass stool. And other question is, do you have any tenesmus? You will know how to ask about that. And urgency and bowel emptiness. So how can I ask about tenesmus and urgency? It's down here. Okay, so you will say, do you feel that despite the urge to defecate, you cannot start it? This is how you ask it. Urgency, do you need to rush to the restroom? Do you feel you will not make it in time to the restroom? Like that. What is specific to the GIT case is a rash. It's already on the mnemonic. Also, if there is a changing in the color of the skin on the eye. Okay, if you think he has eaten any contaminated food. So this is the list for the GIT. Now, what are the cases that you are going to encounter on GIT? It's abdominal pain, nausea, vomiting, heartburn, difficult swallowing, constipation, diarrhea, jaundice, melena, rectal bleeding, hematemesis, and so. So if for abdominal pain, you're going to ask pain questions, and what's specific also is gynecology questions. Keep this in mind. So, gynecology questions, you will find it on Dr. side notes also. Here, nausea and vomit. Also, you need to remember that you need to ask about gynecology. Maybe it's not related to GIT, Maybe she's pregnant. That's why she has nausea or vomit. Also, here on abdominal pain, maybe she's pregnant. That's why she has pain. Or she has ectopic pregnancy and something like that. Don't forget that in nausea and vomiting, you have to be focusing on neuro because it may be meningitis. So, in heartburn case, you need to ask about voice change. Heartburn usually make change in the voice. So this part also is stuck here. And the pain question maybe is a chest pain case. The heartburn maybe is only myocardial infarction and giving the heartburn, okay? And a difficult swallowing, you will ask about few questions, which is voice changing, choking, and if there's any gauge of the food or the fluid. On the constipation diarrhea, you will ask the questions that are specific, which are here, how often, painful, and so. But in constipation, you need to focus on thyroid because hypothyroidism can cause constipation. And you need to ask about the fiber and the fluid intake. So this part also specific to constipation. For diarrhea, also you're going to ask the specific questions, which is here, how often, painful, tenesmus, and so. And you also focus on thyroid. Why? Because also hyperthyroidism can cause diarrhea. Don't forget to ask about antibiotic use on diarrhea. Maybe it's related to excessive use of antibiotic and causing membranous disease on the intestine. Okay? So, a case of jaundice, it's a slightly different case because you need to ask about a few other questions, which is stool and urine color. Maybe it's hepatitis, so you need to ask about also itching and analyze the itching and few things you need to remember. Don't forget to ask about blood transfusion. Maybe it's a hepatitis has been transmitted like that. And if you was immunized before travel, this is very important here. Did you get immunization before you travel to somewhere like Mexico and so? A case of malignant rectal bleed or hematemesis, all these you're going to ask about the ABCO, the amount of blood and the odor and the color of it, and you will talk about it. What's really specific here also that we need to cover the bleeding history. Don't forget to ask if he has previous ectotic patches on the skin, is the bleeding history, and so on. So these are the specific questions to each complaint on the GIT. So now I am standing outside of the patient encounter door, and I am reading the doorway information, and I find the doorway information saying abdominal pain, for example. So my brain now will shift completely to the GIT system. What I will draw in front of me is this paper you are seeing now. I will make the paper for quadrants, and I will write the complaint, OBD, SFC, increase, decrease, GIT, and ABCO. I need to write this also here. This is something different related to the GIT. And I will draw just a line like that. Without writing all these, I will just draw it like that, as if I'm drawing the esophagus and the GIT part. When I draw it, I will know what I'm going to ask about. I will ask from the start, from the mouth, swallow, if he has any nausea or vomit on the esophagus, any burn, any pain, any diarrhea, constipation, any stool problems on the stool or color change and so. So I will write OBD, SFC, ABCO, and I will draw a line. When I draw a line, when I go inside, I will ask all the questions you are seeing here with the orange color. Then I'm going to the circle. After finishing that, I will ask this. When I'm standing outside, it was abdominal pain. Okay, so what is specific about the abdominal pain? I will put on the circle. Oh, going back. Yeah, I remember I need to ask pain questions in detail, and I need to ask gynecology questions. So what are the pain questions on detail? Oh, the liquora. So I will ask the liquora questions, and I'll ask about gynecology. Everything about the menstruation has to be covered. Okay, no, this case is not abdominal pain. This case is nausea and vomit. Okay, I will write OBD, FSFC, ABCO. I will draw this line, and then I go to the circle. Oh, nausea and vomit. Yeah, I need to ask if there's any photophobia. Maybe it's a meningitis. And I also need to ask about gynecology questions. Like that, okay? After I finish all this, I will go to the ROS review of system, which is fever and burn. You remember here the B is for bowel. Don't forget that you are here on the GIT system already, and you have analyzed all the bowel here. So this part is for the chest, actually, pulmonary. P is for pulmonary, so you're going to ask about chest pain, any shortness of breath, any cough, okay? Don't forget that on R, the rash, you're going to ask about the color of the skin. And the rest of the mnemonic was the same. Very fast, going to the gynecological cases, OBF, onset, progression, frequency, and then you're going to ask this large questions. These you will get from the Dr. Aside notes, as you said. You will ask about the menstrual history, pregnancy history, menopausal history, some few questions related to the gynecology, and the safe history. Menstrual history, which is first menstrual period, last menstrual period, is it regular or not, how often do you have it, how long does it last every time, how many pads do you use a day, do you have any cramps with it, is there any spotting in between, did you get any pap smear before, and do you have any vaginal bleeding, any vaginal discharge, any vaginal itching. Now you cover the menstrual. Going to the pregnancy part, you're going to ask, have you ever get pregnant? How many times? Do you have any children? How did you deliver? Was it normal delivery? And do you have any complication with that? And then you're going to cover the miscarriage on the part of pregnancy, miscarriage. Have you ever get any miscarriage? How many times? And in which months did you lose your pregnancy? And then here you're going to ask about the menopausal questions. Do you have any hot flushing, and about urination, this part, do you lose control in your urine passing, you know? And then you're going to ask about some few questions about any difficulty or any pain with intercourse. Then few questions related to the gynecology, which is, do you have any headache, any change in your vision, the breast, do you have any swelling in your breast, is there any breast discharge? And then you're going to ask about the skin and hair changes. And at last, the safe questions, which is, do you feel safe at home? Don't forget this part, please. It's really important. And if she said yes or no, you have to focus. Maybe she has a real problem at home, okay? And then the sexual part here is critical. You have to cover it in complete detail. So this is the list. You're going to know how to ask about all these from Dr. Side Notes. And then when we go to the specific cases related to the gynecology are these: the amenorrhea, the vaginal bleed, the vaginal discharge, the difficult intercourse, if she has a positive pregnancy test, and if you think this is a case of assault. So amenorrhea, beside all these questions you're going to ask in all these cases, each case has its own specific part, as we said before. So amenorrhea, you're going to ask about thyroid. You never forget thyroid. You need to ask about if she feels cold when everyone around is good and comfortable. And you need to ask about the PCO disease, you know, polycystic ovary. So you need to ask about if she feels there's any change in her voice, and depression question. Are you depressed? Then you're going to ask about the vaginal bleed case. Maybe you have a case with vaginal bleed. So in this case, what's specific other than this question is just ask her if she has any easily bruising before. So a case of vaginal discharge, don't forget that you need to analyze the ABCO, and you need to ask her if she is doing frequent vaginal douches. Maybe that's the cause why she has discharge. If it's a case of difficult intercourse, you have to analyze the sexual desire for her. And don't forget that difficult intercourse is a pain case. So you have to analyze pain on detail. You see, if you forget this pain analysis, you ask all these, and you forget just the pain analysis on the difficult intercourse, you lose many questions on the checklist, and the patient, the standardized patient, will give you a very bad score. One of the next cases is positive pregnancy test. You will ask few questions. You will ask is it planned or not? Is this pregnancy is planned or not? Do you think it's a desired or not? And then you're going to ask all these questions. If it's an assault case, I think assault case is really important because it has difficult and different questions. And there is a case on the first aid covering the case of assault, and it has its own question like event description. Did they sexually assault her or just physical? Does she feel any pain anywhere? Did she report the assault or not? And think always that you're going to admit this case if it's critical in front of you. Now, I am standing outside and I'm in front of the patient room, and I saw the doorway information, and I find amenorrhea. She missed her menstruation for a few months, and she's coming to counsel you. So what you're going to do, you're going to draw, as we said, you're going to 2 lines, make the paper 4 quadrants, and then I will analyze the gynecology case, which is slightly different. You see OBF, MP, MS. What's that? This is the complaint analysis on progression frequency, if I want to ask it. And then the gynecology specific part, which is MP, MS. Menstruation, pregnancy, menopause, and sexual. So I just will write the MP, MS, you know, like that, each part above the other one, each letter above the other one. And I will not write this. This is for me to study with. But I just will write MP, MS in front of the door. And I know that this means that I'm going to ask, oh wow, you see all these questions? I'm going to ask all these by only 4 mnemonic, which is MP, MS. Okay? So, and then I'm going to get to the circle, as we said. Oh, wow, it's a amenorrhea case. I need to ask about her weight. I need to ask about voice change because it may be polycystic ovary. Don't forget that. And then I'm going to go to the ROS review of system, which is bowel, urinary, rash, and uro. Wow. On the B part here, we have 3 Bs. Imagine, you can make it like that. Bowel, breast, and belly. So you'll not forget the breast part because most of the doctors usually forget to ask about it. And here, Sawadi, there is few things extra on the gynae case. The safe part here. You see where I put the safe so that I will not forget to ask about if she feels safe at home or not, or she feels stressed at home. So S is for 3S here. S is for sleep, safe, stress. E, you can ask for energy and for exercise if you want to. And the PAMH FOS is the same. But take care. The sexual part you have covered already here, so don't please repeat it. Now we go on to the neuro, which is confusing everyone, and it's long case. First, you'll find me the same system. We have here the OPF and what's increasing or decreasing. And then we have here the neuro. We will ask few questions on the neuro. You also, this part, you know, as we said before, you'll get this part in detail from Muhammad Said notes, but this is for me to remind myself what I'm going to ask about in hint. I'm going to ask about specific neuro questions, and then I'm going to ask about Parkinson. And these two parts are always together when we ask them, the MMSE and the dementia questions. The neuro question, there is 7 questions on the head, 4 on the limb, and 3 on the sense. Head, you're going to ask about the headache, loss of consciousness, concentration, convulsions, forgetting, vertigo, and neck stiffness. In the limb, we're going to ask about weakness, numbness, tremors, walking. And on the sense, you're going to ask about the vision, the hearing, and the speech. On the MMSE and dementia, you're going to ask about the time, the place, the person. We know that. And the 3 words question. And if you know who's the president here now. And we are at the time of elections, so we'll see who will be the president later. And then you're going to ask about the dementia part. You're going to ask about the concentration, if he's forgetting the daily activity, can he cook alone, does he do the whole housework alone, shopping and paying bill alone, did he lose his way home, and his control over his bladder. And then the Parkinson questions, which is the tremors, difficult starting the move, frequent falls, and feeling stiff. What's really important on neuro case and is extra here, that you need to ask about the head trauma and the upper respiratory infection. Usually these you can miss, but you need to remember them. So I always put them here. I will see you how I do this. This is slightly confusing. So what are the cases you're going to encounter on the neuro cases on the CS exam? Is a case of headache, a case of dizziness, a case of hearing loss, a case of confusion, a case of tremors, a case of hoarseness of voice, a case of weakness or numbness in any part of the body, a case of visual loss or any visual problem, a case of loss of consciousness. Okay, these are the cases that you're going to encounter. In all these cases, you're going to ask all the above questions. On the what's extra, we will see. In a case of headache, don't forget that this is a pain case. So a pain need pain analysis, so you will not forget pain. And then you don't forget that in headache case you have to speak about the aura, the timing of the headache. Does it make him wake up from bed? And you have to ask, is it related to menses or not? And you will find upper respiratory tract infection here. Don't forget, upper respiratory tract infection is asked also in the headache case. Now here, because upper respiratory may make you feel it's maybe meningitis, you know? Maybe it's a otitis media causing meningitis, and that's causing headache. Don't forget that. And a case of dizziness. In a case of dizziness, you have to discuss the questions of the ear on detail. And you have to ask about if he feels dizzy in specific positions, okay? So you will ask about these two. What's the ear questions? Go down with me here. These are the ear questions, which is, do you have any pain in your ear? Is there any discharge from your ears? Do you have any hearing loss? Do you hear the ringing sound in your ear? Did you get any trauma to your ear? Okay, so these are questions of the ear that you have to cover here on the dizziness. And maybe you will go to a case of hearing loss. On hearing loss, beside all these questions here, you need to focus on ear analysis, which also the cases we said here, okay? So ear analysis, you will say on hear loss, on dizziness, okay? And then you will have, you need to discuss, did he been under hearing, if he is working on a loud, noisy area or not? Did he insert any foreign body in his ear? And how did he receive the sound? Is it he feel the sound is distorted? Does he understand the sound when he hear it or not? Here also, and yes, don't forget, In all these, the headache, the dizziness, the hair loss, you're going to ask about if there's any upper respiratory tract infection. It's good. It's an important question. Okay. Now we're going to other questions, which is confusion and tremors. Confusion case. Take care that when you are going to the past medical history, he might really don't know what you're asking about on his past medical history. So you need to ask him, don't ask him, do you have any other past medical disease? He might forget. So just ask him, do you have any hypertension? Do you have any diabetes? Mention the diseases with names because he might forget, okay? And you have to ask him about what are the kind of things he is forgetting. This is extra question beside all this list in confusion case. Also, in confusion and tremors, you will ask, beside these, you'll ask the dementia question, the MMSE questions in detail. You'll ask about depression. Maybe he is depressed, okay? And thyroid. It's important here, okay? Thyroid and confusion, tremors, it's important. In tremor case also, you're going to ask, as we said, this one, and you're going to in detail dementia and MMSE, and depression and thyroid, plus caffeine and caffeine intake. Maybe he is taking too much caffeine, that's why he has tremors in his hand. And you'll ask him, did you notice any change in your handwriting? And you will focus here on Parkinson questions. So Parkinson questions, it's not a lot here, but it's with tremor case, you will ask on detail. Hoarseness. In hoarseness case, you will need to focus on upper respiratory tract infection. You need to ask about thyroid, Sometimes hoarseness is only because of thyroid disease. You need to ask about heartburn if he has heartburn, and to ask him if he was overusing his voice, as I am doing currently on this video, and if he has been on cold weather recently for a long time, and does he feel any pain with speech or not. Now, going to a case of weakness and numbness. You need to discuss all of this, of course, and you're going to ask about Parkinson questions. And the bladder control is very important here, okay? And don't forget that if he feel numbly anywhere, and get in detail where exactly the area that he feel numbly. And you might consider admitting this patient, also like the headache case. It's maybe emergency case, so you need to discuss with the patient that he will stay at some time at the hospital so that you will feel comfortable he can go home. A case of we'll go here. A case of loss of consciousness. It's a specific case with its own question style. You need to ask to analyze the event. So you need to ask what happened before he loses his conscious. So did he get in the aura? Did he feel the room spinning around him? Did he lose his conscious first before he fell to the ground? And what happened during the episode? Did he get convulsive? Did he bite his tongue? Did he lose control over his bladder? And what happened after? Did he get any confusion? And you will discuss the MMSA. Okay, last question and last case on the neuro is the visual case. Maybe he will come, I cannot see with my eye, I have some pain. So you will ask about the eye questions in detail, which is here. You see this line? This is the eye questions. Do you have any pain, discharge? Is there any redness in your eye? Are you excessively tearing? Do you feel that you cannot stand the bright lights? And so here, you will also again want to ask about if you feel depression, if he's hallucinating between times, and so. The last line here is something I write here sound, in case of hearing loss, that you need to discuss sound. The sound questions are here. Do you think you hear the word as distorted? If you hear the sound, can you locate the source of it? Do you feel that you understand the speech? So it's a really big paper, but believe me, it covers how many symptoms? 1, 2, 3, 4, 5, 6, 7, 8, 9. So this paper only cover 9 encounters. You will face at least 2 to 3 cases of the neuro. Okay, so if you study neuro well from Muhammad Said, and then you come here to read these parts well, and then you study this, give yourself time. This paper I'm showing you, it's a study of 3 months practicing. But before the exam, I just study these papers and it helped. So if you think it will help, just focus on it, you will get it, okay? So now I'm going to the neuro case. I'm standing outside the encounter. What I'm going to draw and what I'm going to ask about is this. I draw it and the OBF increase, decrease, and trauma. Do you get any trauma to your head? And then I'm going to answer the circle I told you about. The circle here is covering as we discussed, this red lines that I'm going to ask about each specific case. And then the fever burn as it is. Okay, but I add here the upper respiratory tract infection question, exactly like the cardiovascular and respiratory, because it's important. And Sawadi is the same, and Pamich is the same. And Neuro is over. Now go on to the urinary system. Also, you're asked about the OBF increasing, decreasing, and if she has any similar episode in the past. The urinary questions, this part also you'll get from Muhammad Said in detail, but just you'll ask about the frequency, the dysuria, the urgency, if he feel completely emptiness his bladder or not, nocturia and hematuria, any pain on the flank, and if he accidentally passed urine without control. Benign prostatic hyperplasia question, a specific question for that. You'll ask about if he's training to pass urine, does he have a weak stream, if he has any dribbling of urine, and does he feel that he need to stop and start again while urinating or not. What's important in the urinary case, that you need to ask about the sexual history in detail, and if he get any trauma to that area, to the back or to the belly, and if he has any recent upper respiratory tract infection. This will affect also the kidney and may change the urine color. And then you're going to ask about the neuro case. It's important to take care here that your neuro is important in the urinary case, you know, to ask him if he has any back pain, any pain in his leg, and so maybe it's just a neuro case that he doesn't control his urination because it's a neuro case. So what are the cases you are going to encounter as urinary? It's hematuria, dark urine, burning sensation or pain sensation while urinating, difficult urinating, accidentally passing urine, frequency case or impotence. So hematuria, you will ask about how did you know this is blood? This is a really important question. You will tell you I have blood. How did you know? He will say, oh yeah, it looks like blood. It's a fresh. It's not black, and so on. So you will ask about the ABCO, the amount of blood, and so, and you ask him about any history of bleeding. Dark urine. You will ask him, what do you mean by dark? It's maybe hematuria, and he just didn't understand the question. So ask him, what do you mean by dark? He will say it's black color or something like that. So you will understand. Or maybe he will say it's dark yellow, something like that. It will make you focus more. And then you'll ask about. I'm sorry for that because it's our call to pray soon. And going back, I said you'll ask about what's meant by dark urine and the quantity of the urine and about the food. Allahu Akbar, Allahu Akbar. If he took any special food, any candy, it may make a discoloration of the urine. Then you're going to the burning and pain while urinating. You'll ask about gynecological history on detail if she is a female. You ask about vaginal discharge, pain or bleeding with intercourse. So just keep focus on gynae questions in case of burning or pain while urinating on a female. Difficult urination in male, you need to focus on the BPH. So you'll ask about the strain, weak stream, dribbling, and so on. So, accidentally passing urine. This is a really important case, and all of us have faced this case. So, study it well. You'll ask about if accidentally passing while coughing or sneezing. When always do you feel that you pass accidentally during the day? And is there any particular thing you think causing you passing urine? And you have, this question is very important. Does it affect your daily activities? It's really important. And take care of this case, maybe also the breast, so try to counsel well. A case of frequency, you need to ask about if he always feels thirsty or not. If he's drinking more water, maybe just it's polydipsia case, you know, because he is nervous or something. And you need to ask about stress and depression. Very important here. Impotence case, it has its own specific questions like impotence. So you need to ask about the erection scale. You will ask him a specific question about the erection. You'll find all these questions on Dr. Said notes already. Sexual desire, and if he has a morning erection or not. And does he feel this problem with all the partners or specific partner? Does he feel his breast is enlarged, get large in size or not? So now I'm standing outside and I find doorway information giving me a case of urinary system. What I'm going to write on my checklist is like that: OBF, increasing, decreasing, and urinary, BBH, and trauma. So now here I cover all the parts. Urinary, I will cover the urinary here. You know, these three lines is urinary. BBH is this line, and the trauma if he has any history of trauma anywhere. And then I'm going to what's specific to the case, which is I write on red color, as we said before, here and here, depending on what case you are covering. I will just go fast because we discussed already. And fever, burn, as we said. And in neuro, just what's specific here in urinary system in neuro, beside headache, don't forget to ask if he has back pain. Okay, if he has back pain or leg pain, it's important. And on the sleep, stress, and if he feels sad, because depression is common here, and PAMH, and I will always focus on urinary system. I will always focus on sexual and get it on detail. Then you have some general cases, and these cases are the follow-up case and some few cases like weight loss, weight gain, fatigue, and so. On the follow-up cases, there's few questions you need to focus on, which is when the case was diagnosed, since the time is he seeing a doctor or not, and also I need to focus. These questions also found on a side note. So, and you will ask also about when was the last visit to the doctor for follow-up, and what are the medication he's taking, and is he compliant with taking or not? Did he face any side effects while taking them? Does this patient has a device at home to follow up his blood pressure or his blood sugar level, and is he regularly checking it? And when was the last check, and what was the highest and the lowest reading? And if he has any problem to discuss today. So if you just study these lines, you will cover all the follow-up cases, which are these 4 cases: diabetes, hypertension, asthma, and HIV. You just try to read the lines below because I think I'm taking so long time, and I think I will lose your concentration soon. and now general cases. But just before I go to the general cases, what's really important in follow-up cases, and I don't want you to miss that you in diabetes and in hypertension focus on sexual and sexual story and intercourse story. If there's any problem with that. Really important. Maybe it's just a follow-up case to check that there is a sexual problem with the patient, and because your communication skills was bad, you didn't figure out that this patient has a problem. Okay, so don't forget, please. Now here, general cases like weight gain, weight loss, insomnia, a mass on the neck, night sweating, fatigue, violence, domestic violence. Okay. So what you're going to ask about is OBD, SFC, and factors increasing, factors decreasing. Okay, this is important. And then what's specific here that you're going to ask about? Thyroid questions, depression questions, safe questions, if always feel tired or not. And you will focus in gynae, and Sawadi will be on the checklist in a different place. So we'll talk about that. So what's specific about weight gain and weight loss? That you're going to ask, how much did you gain, or how much did you lose, and was that intentional or not? This is a question that is specific for these 2 cases. In weight loss case, you need to ask a question of anorexia nervosa, and these questions are found on Muhammad Sayyid notes. A case of insomnia, you always try to, and the case of insomnia is common actually on the CS exam. So you're going to ask about caffeine intake and some few questions about sleep, and sleep questions also found in side notes. It's a long list of questions, so you have to master them. A case of neck mass, you're going to ask about the mass itself, the site, the size, is it mobile or not, is it painful or not, if the patient has any masses elsewhere in the body, and is this mass is moving or swallowing or not, maybe it's thyroid, okay? And then a case of night sweat, you're going to ask him if he's sweating the whole night or while sleeping alone. This is a specific question here. A case of fatigue is very important. It may be a depression case, it may be a hypothyroidism case. So always you need to ask a few questions, which is this feeling tired or feeling fatigue, is it changing throughout the day? Is it affecting the performance or not? and you need to focus in asking few questions about post-traumatic syndrome. And here, last one is domestic violence. On domestic violence, you're going to ask about the questions of safe. What are the safe questions? Also found on the site, and I write just a few notes here. The safe questions is, do you feel safe or afraid at home? Have you ever been abused by anyone? Have you ever been injured by your husband or your partner? And do you feel your children are threatened? Is there any guns at home? Does anyone of your family is aware about what's happening to you? Do you have any emergency plan if something happened? Do you have any safe place to go if you feel that you are at danger? I said also it's important to ask about the questions of depression. So what are these questions are, do you feel sad? Why? And do you have any thoughts of suicide? Have you ever get any attempts to suicide? And do you have any plan to suicide? Does anyone of your family is aware about your problem and is around to help you? Did you lose interest in life and your activities? Do you have any problem in concentration? So now I'm in front of the door and I find a case that is general. What I'm going to draw on my checklist to ask about is this. I will write the OBF, increasing, decreasing, and I write the event to discuss the event, what happened, when happened, and so in detail. And then I'm going to ask the Sawadi. So you see here, the only checklist that the Sawadi moved from here to here, it's general case. Because actually it's about him, about his general life, which is the sleep, the weight, the appetite, the diet, the exercise. So I describe here in detail, okay? So about the S, it's not one S. It's 4 S's, which is sleep, stress, safe, and sad, okay? In detail. And on the E, you'll ask about exercise, and if always feel tired, it's important. And then the fever, burn. In here, I write it with the green color, the thyroid. It's very important to ask thyroid questions, okay? Which is, do you feel always cold when everyone around you is comfortable? Do you feel always hot when everyone around you is comfortable? Do you have any change? Did you recently feel any change in your voice or not? Do you have any change in your weight recently? Which is covered already on the Sawadi part. Okay, so this one is also the same. And on the past history, the PAM-HFOS is the same. But if she's a female, the gynecological obstetric part will be on detail on this area. Okay, good. Now going to a case of rheumatology. Just try to be fast also because I think the audio is long enough. We have here the OBD, SFC, and the same questions, and then the Licura for pain, because most of the rheumatological case are pain case. As you see here, it's a neck pain, shoulder pain, arm pain, back pain, hip pain, knee pain, leg or calf pain, and heel or foot pain, and the only case different is rash. So rheumatological case is a pain case, okay? So keep in mind, but it's rheumatological, so it's specific to the joint. So we have some few questions that we need to add, which is specific to the joint, like, do you have any swelling in your joint? Is there any redness? Do you feel it warm? Is there any rash? Good. And some few questions associated to your joint, which is, did you get any trauma to your joint? Have been overusing your leg or your arm recently? And then, do you have any pain elsewhere in the body? And then, can you move your leg? Can you move your joint? Can you walk over it? So these questions are specific to the rheumatological case. And on the review of system, which is the ROS, don't forget that rheumatological case is strongly connected to the neuro case. So we're going to discuss neuro in detail, okay? So now going to what's specific to each case alone. If you have a case of neck pain, okay, you will ask all these questions as if it's a rheumatological case, and you will never forget that it might be a meningitis case, okay? So we need to focus. You're going to ask about meningitis questions like, do you have any nausea, any vomiting? Do you feel dizzy? Photophobia, cause, do you have any upper respiratory tract infection, fever, ill contact, recent travel? You will ask fever questions in detail. Why? Because it may be meningitis, it may be an infection. Going to another case, which is shoulder. Oh yeah, I write here admit. neck pain case, if you think it's meningitis, you have to talk to the patient that you will not let him go home until you feel okay that you feel that he will be okay at home. So he will stay with you until you get at least the initial workup that will make you feel happy with him to go home. Okay? Just say this in the closure part, like as follow. Now, the patient has a neck pain and I need to close with him the case. I will say, okay, Mr. James, I think the pain in your neck may be related to the infection that you have, and I'm really worried about infection in your brain. So now I think you will stay with us until we get the initial workup, until I feel, and when I get the initial workup, I will go to discuss with you what's going on and what we can do about it. And I will not let you go home until I feel that you are okay to go. Okay, because I feel worried about you currently. So we'll wait the lab and we'll try to get it as fast as we can. Okay, sir? Yes, thank you. That's it. Don't tell him that I will admit you. You cannot say that on the CS exam. Okay? But tell him that he will stay with you in the hospital until you get the initial workup. Okay? Now, next case is shoulder pain. You're going to discuss all these questions and pain questions, the licora, and then be careful. If it's on the left shoulder, this may be an angina case. So you're going to ask the cardiovascular chest questions in this part on shoulder pain because it's maybe angina, as we said. If you have arm pain, also the same like shoulder pain. If it's on the left side, so if it's on the right, don't care about it. But if it's on the left side, also you're going to ask all the questions of the cardiovascular and chest. And you might also tell him that you need to admit if you think it's an angina case. Back pain. You're asked here about any problem in urination, if he's a male, any problem in erection, and if she's a female, you're going to discuss in detail gynecology questions. Here, hip pain, and this one you're going to ask about if he has pain on the back. It's really important. Maybe it's radiation pain, and it's a neuro case, and you're going to ask about safe questions because maybe this hip pain, the patient has fell down after his husband has pushed her on the stairs or something. So always ask the safe question because getting fracture on the hip or hit femur or something is really rare in life encounter, except if it was intentional problem. So always ask safe questions in here. Knee pain. It's a really important case. Oh my God, I cannot say how much knee pain case is important. Keep eye on that case because you will face it. You have to know that it may be systemic lupus erythematosus. You need to ask about all the questions related to this case, which is photosensitivity, oral ulcers, tick bite. Hair and skin will be covered on the mnemonic. So I'm saying what you will put on the circle questions for this knee case pain. And you need to ask about all gynecological cases. Maybe this is an infection, gonococcal infection causing gonococcal arthritis. So gynecology questions here are important. And also abortion history is very important because if you have knee pain and multiple abortions, you have to think antiphospholipid syndrome, the part of systemic lupus. So keep eye on this case. You have a leg or calf pain case. You have also here to cover gynecology, very important, because this is maybe a DVT case related to the use of oral contraceptive pills. So you need to ask gynecological questions on the leg or calf pain in detail. And you need to ask about recent immobilization. This is very important. Have you been immobilized for a long time? Do you have a long travel flight and you have been staying there for a long time? So always ask these questions on the leg or calf pain. In a case of heel or foot pain, we will also try to cover the oral ulcers. If there's any problems on the eye or photo allergy, and if there's any discharge from the urethra, because you are thinking maybe it's an reactive arthritis. So all these questions are important here. A case of rash is a different case. It has its own questions. You'll find it also on the first aid long case of rash. You have to describe the rash in detail. And is it itchy, burning, is it numbing or not? And the fever questions have to be covered in detail also. And if the patient has been bitten by insect or an animal, if there's any joint pain, and you have to ask all the systemic lupus questions, which is here, okay? And then at last you have to ask also gynecological questions, because this is maybe a sexual transmitted disease causing rash, you know? Okay. If you have any history of fall in any case in rheumatology, you have to ask that patient, did you see the doctor that time you have the fall? If you say no, because take care, usually these cases are old patients and maybe they are abused. So maybe this is a case of elderly abuse or female domestic abuse. So you always have to ask, did you see the patient that you see your doctor that time you have the fall? If he said no, I don't, you have to ask why not. If he say my son was not having time, something like that, and you feel him not comfortable while responding, you have to think that there is maybe abuse, and you have to go to the safe questions and ask them in detail. Now there is a case different, which is a motor vehicle accident case. This case you have to focus on it. It's already on the first aid. Read it well. What's different here different from all these questions, that you're going to ask him if he was under the influence of alcohol or any drugs. This is very important. And also you have to ask him if there is any discharge from the nose, ear, or the mouth. If there is any discharge like clear discharge or bloody. Maybe he is leaking CSF and it's an emergency. Maybe he has some bleeding anywhere. So these questions are specific to the motor vehicle accident. Now I was standing outside of the room and I need to discuss them. Wow, I think it's stuck here. Just a minute to see what's wrong. Okay, we fixed the problem. Okay, so you have the checklist for the rheumatological case. You find a case of shoulder pain, and you start to draw your drawing, your checklist, and you start to write like that. OBD, SFC, and LICORA is important here because all the rheumatological cases are pain case, and then this is the specific part of rheumatology. It's the joint questions, which is on the back, the page before, and can he move it or not, and if there is any pain elsewhere in the body. Okay. You can ask a question, what was you doing when the pain started? Okay, you can ask this question. Sometimes it solves many problems. Okay, I was hiking and I fell down. I turned around. I feel pain on my back. Something like that. And then you're going to ask these questions, which is on the circle, which is specific to each case. And remember that gynecological questions, it's very important also in the rheumatological case. It's related to most of the cases on the rheumatology. Then the review of system, which is the burn and fever on detail, of course. Fever, burn. And then the Sawadi questions. Just be fast with the sleep question. How's your sleep and so on. Not much important, but just ask it fast. And on the E question, exercising, overusing, and trauma will be asked in this part. Do you exercise regularly? And have you been overusing your limb? Or do you get any trauma? You know, I have a case. When I asked him, he has knee pain. And I asked him all the question of the knee pain. And then I asked him, did you get any trauma? He said, no. I didn't find the cause actually for that. But when I asked him if he has overused it, wow, he told me, I don't know, doctor, maybe because I was hiking and then when I was turning around, I didn't get any trauma, but when I was turning around, I hear bobbing sound on my knee. Imagine. So you have either two questions to ask. What was you doing when the pain started? This question, or have you been overusing your joint? This is important, okay? And then the past medical history is the PAM, HFOS, we agreed with. Yes, that's that. Okay. I need to tell you that I always depend on the mind map. Mind map is very important. It keeps your brain prepared well. This paper, I have almost just make two papers like that. I will tell you what is these exactly. And I put them, these papers was on the wall of my room, okay? I look at them before I sleep every day for almost 5 to 6 days before the exam. What are these? These are the checklist of each system. So this is the check. You see this part? This is the checklist of the gynae. This is the checklist of the urinary system. This is the checklist of the general case, and this is a checklist of pediatric case. Okay. So what is this? This is what I'm going to write on the door when I'm going inside. You know, we discussed the gynae case and how we draw the checklist of it and what we'll say on it exactly. So I just want to remind myself what's different on the checklist of each system so that I will not get confused, you know, because it's 8 papers, 8 checklist, I will get lost on it. But when I draw this and every night I look at it, I have my own mind map. So here, gynae is OBF, what increase, what decrease, okay. MPMS, which you said menstrual, pregnancy, menopausal, and sexual. Oh, wow. And here the fever burn, yeah, it's the same, but BBB. The bowel, the breast, and the belly. Wow. When the gynae case, I need to ask 3S, which is sleep and stress, feeling sad. Okay. And I have to focus on the sexual. Oh, wow. That's why I do a circle over the S. In case of urinary system checklist, it's the same, but there's some few changes, which is OBF, increase, decrease. Oh, yeah. But here, I draw U, which is urinary. And here, oh, wow, I need to add the trauma part. So, and here, fever burn. What's specific that I need to ask about upper respiratory infection? Okay. And the S also, I has to focus on it. If there is any sadness, stress, and so. A general case, I will draw it. OBF increase, decrease, welcome. But I move the sawadi from here to here. Oh, that was different. Yes, I remember that. So, and on the S part, it's 4 S's also. The sleep, the stress, the sad, and so. And in E, I add the tiredness. And here, I said thyroid is important. Thyroid here is important. And occupation or, the obstetric history is important also in case of general. Pediatric case, I don't know if I have a slide for it. But it's slightly different. Here, I leave this paper to write all the details of the case of pediatric. And I have a specific mnemonic, which FCE burn. And FCE burns and the IDE. I will tell you later if I have time to discuss the pediatric case because it has its own mnemonic and its own style, and it's usually a telephone case. It's not a patient. Sometimes you might find a father waiting you in the room without a gown. Maybe this is the father of a pediatric case and he is coming to you to discuss a case of his child, and you will go also with him with this mnemonic. I hope I have time to discuss later. Oops. Yep. This is the second paper I told you about. I have only 2 papers about the mind map. This is the checklist of rheumatological case. And it's OBF, rheumatology, as we said, LECURA, because it's a pain case. And I have few questions for the joint, which is the joint, the moving pain of over the body. In the rheumatology case, on the fever burn part, I will focus on neuro. That's why I make circle around N. And I will ask about, after the sawadi, I will ask about overusing or trauma. And it's all the same. In the neuro case, I will ask about the OBF increasing, decreasing. I will ask about head trauma questions. On fever burn, it will be the same, but I will ask about upper respiratory infection in detail. And the neuro question has to be covered, which is, you remember, I told you there is 7 on the head, 4 on the limb, and 3 on the sense. I will ask these questions. Also, I will ask about the SSS, 3 parts of S. And that's it for the neuro. Cardiovascular system and pulmonary system, it's OBF increase, decrease. What's specific to the cardio, what's specific to the chest. And here, as we said, the fever burn is okay. Fever on all detail, and getting fever, chills, sweating, ill contact, and traveling. And also, what's specific here is the PPD test, heartburn, and upper respiratory tract infection. And the rest is the same. On the abdomen, it's OBF, increasing, decreasing. And I told you I drew this to remind myself that I'm going to ask about difficult swallowing, nausea, vomiting, abdominal pain, stool, and constipation, diarrhea. And on this part, I'm going to ask F in detail, and B is not B, it's P. P for the pulmonary system, I will ask it in detail, and the S also, I will ask about stress and everything in detail. And O, to be also in detail about the obstetric system. So these are the mind maps. That was my own strategy. It's a long strategy. I hope you like it. And I hope it helped you. And I hope you don't hate me. I'm not trying to make it difficult for you, but believe me, many friends have started with my own strategy. They finish fast, they study well, they find their brain organized more, because when you go to the CS, you'll find yourself at last lost on the encounters because there are so many cases. Imagine yourself saving 48 long cases with all its question. No, you are going to save only 8 encounters for all the systems. This is nice, and it will help you. Believe me, only we were 5 entered the exam, and 2 only study with this system. Me and someone else who took it. After he studied alone, he find the system very good, and he changed his own system 2 weeks before the exam, and he started to study with it, and he passed the exam very nicely, and he said it was very helpful for him. I hope you like it, and I hope it helps you. So currently, now you finish all this. Now you finish all the systems. Yes, you finish all the systems. Congratulations. So what's next? People, the physical exam part. We didn't start it yet. Okay. So how I will learn my physical exam and how I will do it on the encounter. This comes to the video step, which is the CSE videos. CSE videos, you have to take them from anyone who have them offline, and I think they're worth to buy online if you don't have it. Really important. Watch each system alone. Try to simulate them, and believe me, with time, will be perfect. Physical examination part doesn't want to take so much long time before going to the actual exam. Pay your time in the studying, in the histories and the formula. I start studying physical exam part 1 week only before my real exam, and it was nice. I encountered everything in a short time. So I mean, it doesn't need a long time to practice the physical exam part. Okay, so don't worry about it. Give it 10 days. On the 2 weeks I told you, you will dedicate yourself. 10 days at the end, or even 1 week before the exam is enough. You will study the CS exam videos, and it will help you. Second source is the Assembly World videos. They will teach you how to do the proper examination, because CS exam videos are you know what you can say as the excellent physical exam and the practical physical exam. I can teach you to study and do physical exam of the head in 10 minutes. Head only, you know, doing a general examination of the head on 10 minutes. And I can teach you how to do a head exam in 10 seconds. So the USMLE World will give you the excellent, perfect way to study the head on 10 minutes. But this will not be practical on the CS exam. So that's when the CSE videos come. So you need to watch how can you do the perfect exam first, so that you can do it on a professional way, and then you have to know how will you do it on the real life, on the real CS exam. How you will do it fast, and what exactly you're going to omit, so that you can manage your time when you're doing examination. So I watch USMLE World first to get the actual perfect way of examination, and then I see CSE videos to know how did they do the most important part, and how can I make my own physical exam strategy going well. That's why I said at the end, you have to have your own style of doing the physical exam. You have to be fast while doing it. You have to be efficient, and you have to be comfortable. When you are comfortable, the patient will be comfortable with you too. Okay? It was the most lovely part on my exam, which is the physical part actually with the patients. It was very nice. I just was talking with them, and they are smiling. We are looking to each other. I do the maneuvers. They are happy. I need to tell you something also. When you're going to the chest examination and you're going to listen to the chest, listen only to 4 partitions on the back. Okay? Don't listen to 6 or 8. Okay? People do this. This wastes time. Really, it wastes time. Just tell them, please, can you take a deep breath? Another one. Another one. Last one. Thank you. That's it. Don't do it excessively. You will lose time on it, and it will not add you extra points. At last, I want to tell you, 2 weeks before the exam, you will be in the United States. There, you will practice live with someone, any partner, especially to master the encounter time and the communication skills part with your partner. It's really important. You will not know how bad you are on the communication skills and your English pronunciation, except when you have someone else doing a mock encounter with you. So prepare yourself to have a study partner when you go there. Contact everyone on the Facebook and on MTAR too to catch someone there. So study partner you will find online. Believe me, you will find. Trust God. Just enter all the I don't know, all the websites, all the forums about CS exam, and you find someone. And I need to teach you something about how can you make your practice with your study partner efficient. On YouTube, you will find a few videos called USMLE Timer. Okay, this video is extremely important. You will go there. While you are practicing with your friend on the Skype or anywhere, you will be working this video in the background while you are practicing. Why? He will give you the same encounter. Okay, so he will tell you, please prepare. Examinees, you may start your patient encounter, and then the time will go on while you are practicing with your friend, and suddenly you will find someone saying, examinees, you have 5 minutes remaining. So you know, oh my God, I'm taking so long time. I didn't finish my history yet. I still need to do my physical exam, and then I still need to do counseling and closure. So I'm taking a long time. So you need to know how to finish your practice with your friend on Skype within the time. So every day from the start, I need to tell you something. From the start of your study study with your study partner, from the start with the USMLE timer. Don't say, no, I will start practicing without the timer and then I will practice with the timer. No, you are wasting your time. From the start practicing with the timer. So now I am practicing with my friend on the Skype. How can we cover the examination part while we are on Skype? Okay, while you are online, how can you cover that? I will tell you. Now I'm with my partner and he gave me the scenario, and I now click start the timer, and we start the encounter, and I knock the door. Mr. James? Hello, Mr. James. I'm Dr. Asmaa. I'm physician attending here today. I'm here to take care of you. Nice to meet you. Okay, I'm going to ask you a few questions and do physical examination. Do you mind while we're talking? I'll be writing down some notes. Thank you, sir. And then I go to the history, and then now I would like to do physical examination, a quick physical exam. Can you excuse me to wash my hands? He will say yes. So I will take a minute as if I'm going really to wash my hand. And I will tell him, okay, sir, is there anything else you would like to add? He will talk with me while I was washing my hand. And then I will come. This is the physical exam part. I will do it online. I will say, I will imagine there is a patient in front of me and what I'm going to tell him. I will not do anything, okay? But I'm trying to imagine that I'm doing the physical exam. So I will say, okay, Mr. James, now I just will have a general look. Can you look up with your eyes? Look down. Can you open your mouth? Can you say ah for me? Now I'm going to palpate your neck, to check your neck. Okay, just a minute. Okay, I'm going to listen to your neck, to listen to the vessels in your neck. Thank you. Now I'm going to listen to your heart and your lungs. Is it okay? Can I untie the gown? Thank you. Then I'll untie the gown. And then the gown going down. Now I listen to your heart. Okay. Okay. Can you take a deep breath for me, please? And I listen to the chest from the front. Again, please. Okay, I listen to the chest from the back. Is it okay? Thank you. A deep breath. Again. Again, please. Okay, last time. Thank you, sir. Thank you, very helpful. Now I'm going to tie your gown. Okay, can you give me your hands? I need to check your pulse, please. Okay, thank you. Now, I would like you to lay down for me because I need to check your belly. Is it okay? Okay, let me help you. And then you catch his hand and you help him while he is lying down with your left hand. And your right hand is pulling the extension to the foot. Okay. Then you're going to put the drape and help him. Let me help you, sir. I just will see your belly to examine it. Is it okay? I will elevate the drape a little bit. Elevate the drape. Listen to the belly. Now I'm going to have just a look to your belly. Okay. Now I'm going to listen to your belly. And then you will put the stethoscope in 2 to 3 areas. Okay, thank you. Now I'm going to press a little bit in your belly. Sir, if you have any pain, just let me know, okay? And then superficial, slightly deep, Okay, thank you, sir. And then you cover the belly and let the patient sit down. Okay, let me help you again to sit down. And you catch his hand, you push the foot extension go down, and then he sit down. Okay, sir, now I have finished my exam. I need to discuss with you. You have told me from that and that and that, and you can discuss and you can counsel. So while you are online, you will do the talk as if you are doing the physical exam as I'm doing now. So your tongue and your mind will be practicing what you're going to say. And then later you're going to know how to do what you're saying. Okay? Okay. Then I'm going to say you need to custom yourself while practicing, that you will need your own private style of the examination and you need to fix it. Okay? This is very important. And you need to manage yourself. While practicing the physical exam, I remember that I was always putting my mobile beside me and I was working the time, watch time beside me, so that I know exactly how long did I take on the physical exam. I needed to be 3 minutes. Wow, 3 minutes. Sometimes I needed to be 5 minutes or 4 minutes, maximum 5. 5 is much, you know. And I practice until I know what I'm going to omit, what I'm going to keep, how I will do it fast and quick, and I know how to do it. I hope someday I can do a physical examination with someone having camera, so that he will, I have a video showing you exactly what we can do on the physical examination part. I don't know if I can do this or not, but I will plan to do it soon, inshallah. I hope so. However, now, studying with your study partner, you're going to study the long cases on the first aid, because it has the questions you are going to ask, it has the counseling part and everything. And you need to study each system alone first. And at the end, you have to get mixed cases so that your brain will be, brain warming, because you're now facing the same exam, multiple cases from each system from all over. So now I am in the United States. I will practice with my partner live, and I give you advice. Before the exam, you have to need to take 4 hours complete full time of practice with your partner before the exam, so that you will feel exactly how the exam looks like and how you'll get tired on the exam, to be prepared well, because the exam will be 8 hours. So if you survive 4 hours with your partner, this means you will survive the exam. Okay? At last, I need to tell you something about the strategy to get success. Few lines. First is faith. Believe. Faith in Allah is everything. Faith that He will help you. And faith that you are a good doctor and you are going to do your job. Faith that this patient is a real patient. Please, he's a real patient, okay? He's not acting. He's a real patient. And you need to do your best to him. And you keep a positive attitude, because you are not waiting him to give you a grade. You are there to help him. He is not giving you evaluation, okay? Just keep this in your mind. It will help you. Then your English. You have to work in your English. Now you listen to my English. It's not good. It's acceptable. English. My English is acceptable. So how can you improve it? You have to listen a lot to get the accent and to get a good pronunciation of the words. What really matters is the attitude. Really the attitude. If you have a good attitude, smiling well, laughing with the patient. I laugh with many patients. You have to keep focusing in everything the patient do. This will give you a bonus, okay, and make the patient feel that, oh, this is my doctor. This doctor cares for me. Then you have to thank the patient. If he let you examine him, thank you. If you ask him a question and he said, okay, doctor, you have to say thank you very much. You have to shake hands. When you go in and when you go out, shake hands with warm shaking. Not just as if you are, I'm a doctor, you're a patient. No, shake hands. Good shake hands. Be a human. I am better to say, be a Muslim with manners. Show yourself, okay? My most important advice will be, don't fake anything. They are patients, and if you think for a second, as I said, that they are acting, you will fail the exam, okay? They are just patient. They will not say if you are a doctor or not. So give your care. Be a doctor with a good attitude. This is the whole plan, to be a doctor with a good attitude. You have to remember that there is a part on the checklist to the patients. I don't know about it, but a friend told me that at the end of the checklist, there is a question to the standardized patient. They ask them, do you want this doctor to be your future doctor? Oh wow, this question can make you pass or can make you fail the exam. So if the patients, most of them said, no, I don't want this doctor to follow up my case or be my future doctor. This means you cannot enter the United States system. Okay, your patient doesn't trust you. Your patient doesn't feel that you're worth to take care of him. This is really bad. And how do your patient will feel that? He will feel good if he feel you are caring for him, if you feel that you are really trying to know what's going with him, if you deal with him in a good way, and you feel and he feel that you are confident. Oh wow, my doctor is a confident doctor. He is not afraid of me. He is not panicking in an exam. It's an exam to test if he's a doctor, and he is really a doctor. He showed me he's a doctor. He doesn't show me that he is an acting person. So this is really important. Another advice, when there is an emergency case, like if you think it's a bleeding, intracranial bleeding, or you think it's a meningitis case, or if you think it's a myocardial infarction case, you need to seem worried about the patient. As if you are in real life, you are worried about him. Tell the patient that the lab will be done today, okay, and he will not leave the hospital, as I told you, until you have an idea about what's going on and you are sure it's okay for him to go home. You need to feel that you are feeling comfortable about letting the patient go home, because if he go home and he die there, it's your responsibility because you take it lightly. Please tell him that you are worried, and he will not leave the hospital until you are comfortable that he will be okay at home. So at last, this is the last slide, I think so. I need you to just remember to pray for me. I need all the prayer. I will be thankful if anyone pray for me, and I need you to keep always good motivation in your heart to your nation and to all the people that needs you. Please teach others. Please help others. Be a good model. Be a good doctor. Be a good Muslim. In Islam, our Prophet told us that you have to teach everyone. Don't stop teaching, because if you have a knowledge and you didn't transfer to others, you are in hell. Imagine that. At last, I would say, may Allah guide you, all my colleagues, in your future. And I need to thank some people, especially Dr. Ahmed Hamid and Dr. Ahmed Anwar. They are from Alexandria University. They have helped me a lot to record this video, and they have given me some guidance about how to do it in the right way. So may Allah guide you throughout your way. And at last, I need to thank you all for listening all this time. And I think it's almost 2 hours and something. So thank you. And I hope for all of you to pass with success. If anyone have any other questions, you can ask. I will do my best to answer. And as I promise you later, I will try my best to have a video about how to do the physical exam. And if I have any other advices, especially about the pediatric case and others, I'll try to do another video later. I hope you enjoyed. I hope you like it. I would say I would see you soon. I hope so. Take care, people, and bye-bye for now.